My name is Norm Volsky, your host, and this is the Digital Health Heavyweights podcast.
Thanks, Norm. It's an honor to be here, and it's been fun to work with you over the years.
Hello, and welcome to the Digital Health Heavyweights podcast with your host, Norm Volsky. And today we are thrilled to have the CEO and founder of Misalud Health, Bismarck Lepe. Bismarck, welcome to the podcast.
Hi, Norm. Thank you for having me.
Yeah, we're extremely excited. If I'm not mistaken, this won't be posted for another couple months, but you guys just got some funding recently. Congratulations.
Yeah, we've had a lot of interest around what we're doing, so we're very excited to have the venture capital partners that we have.
Incredible. Super happy for you and the team. So for all of our viewers and listeners that aren't as familiar with Bismarck and his company Misalud, Misalud is a leading digital health platform that provides affordable, same-day bilingual Spanish and English, physical and mental telemedicine consultations in both the United States and Mexico. With a vision to improve access to healthcare, Bismarck has spearheaded Misalud's mission to break down language barriers and cost barriers in the telemedicine space. Before founding Misalud, Bismarck co-founded Wiseline, a global product delivery company where he served as CEO for over a decade. Under his leadership, Wiseline became one of the fastest growing tech companies, partnering with industry giants including Fox, Disney, Google, Nike, and Stripe, among others. He remains on Wiseline's board today. Prior to that, Bismarck founded and was CEO of Oyala, a video streaming company acquired by Telstra in 2014 for over $400 million. So really excited to have you on the podcast and ask you a lot about your healthcare journey.
Oh, fantastic. Happy and excited to talk about it.
Great. Fantastic. So let's start with your incredible experience in building Wiseline. Walk us through about what gave you the inspiration to start that company, and how did you build it?
Yeah, absolutely. So I live in the Silicon Valley, and I got here in 1998. And when I arrived, I was going to be a physician. I was going to study bio and then go into med school. But I started seeing a bunch of 22-year-olds driving really nice cars. And I'm like, well, they're obviously not physicians. And this was kind of at the peak of the dot-com bubble. And so I changed my focus and I went down the path of technology, studied economics and computer science. After I graduated, I went to work at Google. And then when Google acquired YouTube, we started this video platform company called Oyala. And the idea was to help media companies and all companies that wanted to get into the streaming space to be able to do it. We were basically providing all the infrastructure for that. And one of the things that we did at Oyala was in 2009, as the economy was starting to improve, coming out of the financial crisis, we knew it was going to be difficult, almost impossible to hire and retain great talent in the Silicon Valley. So we ended up scouring the earth to figure out where we could set up an R&D center. And we found a lot of talent in Mexico. And my family's originally from Mexico, but I wouldn't have thought putting a development center in Mexico. But at the time,
What part of
Mexico
Mexico is your
Excuse me?
family from? I asked what part of Mexico are you from, your family, and then where was your development center?
It was central Mexico, but that was near Guadalajara. But that wasn't the reason we set up in Guadalajara. We ended up finding these two entrepreneurs who were really good, and we told them, like, why don't you come be an intrapreneur and come set up our operations? And we ended up finding phenomenal talent. And so when we sold Oyala and we started Wiseline, we wanted to solve the problem of helping companies get better products to market faster. Because we found that at most companies, between 60 and 90% of the software development actually goes to waste. Features aren't used, aren't sold, or never completed. And we thought we could solve that. Eventually, it turned into a services company where companies outsource the development of their new R&D and their new technology and products to us.
Fantastic. What were your greatest challenges in building Wiseline?
Well, we initially started that company as a technology SaaS business, and we built a platform to help companies prioritize. And at a certain point, our customers were asking us for something completely different, which was, just actually help us build out the roadmap that we have. And that was a completely different profile of company. Uh, I had never run a services company. I'd worked at Google. I'd built products. I was a product-driven person. But that's where the market was taking us. And so during that period of time that we shifted from a SaaS business, I had to completely change the network of people I knew and I hired and I partnered with, right? Like most of the investors I knew invested in product companies. The people who invest in services companies, very different. Most of the people I had hired had worked at product companies, the engineers, the salespeople, the customer services is a little bit different. And so making that shift was tough. I ended up having to be the funder for the company for an extended period of time. I think I ended up putting $7 million into the business before we actually got a private equity fund to come in and invest.
Well, you showed massive amounts of belief in the business. What were your greatest successes in that time?
I think one of the greatest successes, for me, I grew up fairly poor. My parents were migrant field workers, and they always invested in education, but we just didn't have any of the frills. Like I was able to, the year that my parents, on their W-2s made $13,000, they bought me a $3,000 computer. And so they invested in things that mattered, but we never got computer gifts Christmas gifts or birthday gifts. And so it just wasn't great growing up that way. Parents are phenomenal. And so I just didn't want to be poor. And so for me, that was always a drive. Like I was going to be a physician to go and make money. And then, I ended up working at Google pre-IPO, and I made a little bit of money on the pre-IPO stock. And after that, the pursuit kind of became something very different. And in opening operations in Mexico, I saw that given my experience, given my network, the same opportunities that I was able to have in the Silicon Valley, I could actually transplant and bring them to Mexico. And so I think that through our companies and our nonprofit startup GDL, we've created thousands of jobs, and I think have helped, potentially bring tens of thousands of people into the middle class. And so for me, the impact that our companies can have beyond just building a successful business is really special.
That's incredible. Awesome mission, and great way to wake up in the morning Monday through Friday and know that like your day has purpose, and all you're doing is helping other people as well.
And it also helps to attract the right kind of people, right? It's people that aren't just coming in for the paycheck, but are also terraforming their communities and really trying to improve their communities.
Yeah, it's awesome. Walk us through your incredible partnerships with Google, Nike, Stripe, and others.
Well, I'm a big believer that you should never burn bridges, and your reputation's the thing that matters most. And so I think throughout my career, I've shown that I am honest, hardworking, can build great teams and great technology. And so we parlayed the relationships we had at Google to help us build Uyala, which sold into the media space. And then when we started Wiseline, we went knocking on doors where we knew that doors would fly open because people knew that they trusted us. And then after that, it was the work that our teams did in delivering value for our customers. And so it builds. Your reputation doesn't build overnight. It's built over decades.
Very much so. So what's the difference between building a product delivery company and now building a digital health company?
So I would say product services, and now, in many ways it's tech-enabled services, right? So product companies, you have customers, you want to deliver customers, but you move at the pace of your product roadmap, and your product roadmap should be dictated by overall engagement of the features that you're building. And so you don't really need to touch your customers as much. I'm a big believer in going out and meeting them and seeing them, but for the most part, product-driven sale can, in some cases, just be driven by a swipe card, right? You swipe your credit card and you access certain products. The services business, well, we, for the most part, our business was tied to the products we would build and the people that we would hire that we would staff onto projects. And so our revenue grew pretty linearly based on the size and headcount of a company. And as most people will tell you, people are complicated, right? Zeros and ones are zeros and ones every day of the week. People are different. And so that, that has its complications. Now, given that we did have a unique proposition to bring to the Mexican employment market, I think we were able to attract a lot of phenomenal talent that was also mission driven. And so I don't think we had a lot of the people issues that a lot of other companies may have that are services driven. Now with Misalud, I'm excited because it feels a little bit like the early Google days.
Okay.
And the reason I say that is because, everybody understands that healthcare has a lot of opportunity to improve the results for the people that, for all of us. It's
There's
$4.1 trillion
plenty of
dollars.
areas of improvement out there.
Exactly.
Not even close to perfect.
And so we're approaching it differently, right? We've taken pages out of other people's playbooks, like Livongo, who used health coaches to be able to guide people's wellness. Um, but we're also taking, from our experience in the nearshore market and taking incredibly talented people here, specifically Mexico today, to act as physicians who are there, who make a tenth of what a physician makes in the US, to act as health coaches to guide people through their wellness journey. And between 90 and 95% of consults start and end with these physicians. And so you're able to get the cost arbitrage that we pass along to the employers who are our customers and obviously the users who end up using this. And given that we're starting with the US Hispanic market, U.S. Hispanics or Spanish speakers are underrepresented across the country, and so this gives us a cost benefit and also a staff and access benefit.
Yeah, I love it. So is the commercial model selling to employers, selling to health plans, a little bit of both?
We've started with employers. We do plan to go into health plans. We're starting with agriculture. Going to manufacturing, hospitality, so places where there's a high concentration of Hispanics and Latinos. But about 20% of our consults are 100% in English, and one of our customers in one of their agricultural sites, there are a lot of Punjabi Indians, and so the consults were 100% in English. A new customer recently asked us if we speak Haitian Creole because the plant that they have where we're about to deploy, they have a lot of Haitians.
Okay. Is that on the product roadmap to maybe get some additional language functionality?
Well, we like to say that we're at the intersection of technology and empathy, and combined, we have kind of this unique proposition of the Misalud Health bedside manner. And so we think that by marrying technology with phenomenal physicians that have an understanding of the culture, we can offer better outcomes for our users. And so, yeah, I mean, one of the directions that we're currently looking at is dermatology for the Indian community, because our Indian patients or users will tell us that, look, our diet is very different. We have oilier skin. And if you have a white dermatologist that has only ever studied in the US, like they may not have an appreciation for what's required in order to treat us. And so, yeah, I think that with our platform, we can extend and expand to all groups. We are focusing right now on the lowest hanging fruit, which are obviously Spanish speakers in these healthcare deserts. But we believe that we can create a parallel system that's a lot more cost effective and a lot more accessible.
That's great. Really, really good stuff. What inspired you to get into healthcare? You were very, very successful in, let's just say legacy tech. And healthcare, is a different beast. It's usually 20 to 30 years in the past, when it comes to like what some consumer technology groups are doing today and brands, those are things that might not be seen in the healthcare world for another 20 or 30 years. why tackle a market that tends to be late adopters?
I think because we can bring value and like we truly believe that we have an approach where we can bring value. And the reason that we did this is at the start of the pandemic, we found that US Hispanics were the most impacted by the pandemic, right? 4 times more likely to die, 3 times more likely to be hospitalized, twice as likely to get COVID. And the main reason for that is it's over 20% of the population and working in frontline jobs where they didn't have the luxury or the privilege of being able to work from home. And as we dug into that problem back in 2021, we realized that it was an access issue. Like these people did not have physicians. If there were FQs in their local, in their communities, they would be closed by the time they got home. And then obviously, very few Spanish speakers out there that are physicians. In California, since 2014, 38 hospitals have closed in these, locations. And so we started to explore this model of leveraging talent in Mexico to be able to deliver services in the U.S. And as we dug deeper, we realized that we could do it. And so we wanted to go after this because we thought we could have a positive impact and obviously build a big business. Especially after starting a nonprofit, I believe that capitalism and companies are the best way to be able to do a lot of good. If the companies do really well, they can do a lot of good because it's a self-funding process and a self-funding
Yeah.
model.
Yeah, no, I completely agree. Approximately 13% of the US population speaks Spanish as their primary language. Like, how is language a huge barrier for care in the United States for English as a second language patients?
So as of 2022, there were roughly about 63, 64 million Hispanics in the U.S. Given the recent immigration influx, some calculations put the number of Hispanics in the U.S. closer to 75 million. About 60 to 65% of those are of Mexican heritage. And of the Hispanic population, about a third to half would prefer to conduct their lives in Spanish. And when it comes to healthcare, 3/4 would prefer to conduct their lives in Spanish. 3/4 speak Spanish at home as their primary language. And so there's just this big supply and demand gap in what we can and should be offering. And so we suddenly have a population, if we think about the Spanish speaking world, it's significantly larger than the overall population of the US. And so we think that by using technology, we can bridge that gap. Right now, we're virtual and we partner with physical partners. So if you actually do need to see someone in person, we do have partnerships. On our 5-year roadmap, our goal is to eventually also offer in-person and physical locations.
That are owned by Misalud or just partnered with Misalud?
Right now we're partnered, but eventually we think that we're going to have a lot of really interesting data to figure out exactly where we could, bridge this technology, virtual and physical experience.
Yep, 100%. So language is not only a barrier for care, but an indicator for higher, percentages of chronic illness, avoidance of care, etc. Like, how does that all intersect?
Well, look, today we primarily sell into employers. Eventually, we do plan to be part of health plans. But let's talk about workers' comp. Someone working in a packing plant, they get hurt. They sprain their arm, they go out on workers' comp, and then a physician needs to clear them to be able to go back. But as soon as they go see the physician isn't able to clear them because of H1C or they're diabetic, they're pre-diabetic or diabetic, or they have hypertension, and so they have these underlying issues that they never took care of that now impact the overall employer. And so in working with companies, we start with a wellness fair. We come in, we do blood draws, we get their biometrics to make sure that we have a baseline. And then we create programs that through the virtual care they have an ongoing relationship with a health coach to make sure that their overall vitals continue to improve. And so it makes sense for the user, the socio, as we call them, and it makes sense for the employer because they're able to lower their overall cost and increase the overall productivity of their employees.
Yeah, that's fantastic. One of the statistics that just jumped off the page to me was your enrollment rates. Misalud, on average, is getting 40% enrollment within their patient populations. Industry average is 4 to 8%. And I'd even say that statistic is, let's just say a rose-colored statistic, and probably optimistic, if I had to guess. What are you guys doing that's way different and unique, getting these just outstanding results?
So I think healthcare moves at the pace of trust, right? And while virtual care and telemedicine allows us to build this business model, if you don't have that trust, it's going to be very difficult for you to get anybody to use your platform. And so, like I said, we do work closely with the employers, and we, as part of our contracts, they fund a wellness fair where we come in and we partner with LabCorp and Quest and others to do vitals, and they get to know the Misalud physicians and they get to know the Misalud health coaches. And so you create that initial human bond, and then on an ongoing basis, they've built up that trust. And then eventually it becomes a self-fulfilling prophecy because if people are getting this care,
Yeah,
they're going to lose weight, they're going to be healthier, they're going to be happier, and then they're going to tell other people. And so not only is our enrollment rate high, our engagement rate is above 80%. And so people use the platform.
fantastic.
And the employers are also, we work with them to set up in the same way that there are mothers' rooms
Yep.
at our customers' locations. They also have Misalud rooms where people can go and have their consults because we offer both physical and mental health. And so for them to actually be able to speak with someone.
That's fantastic. Can you walk us through the different verticals that your company has? You have physical health, mental health, employee wellness. Can you kind of walk us through, what the patient experience is for each?
So for physical health, we'll come in and we'll do the vitals and then get everyone's baseline and put them in a program. And so from that point forward, they are going to have a schedule of visits with their health coaches. And the employer pays on an annual basis, and the individuals have almost unlimited number of sessions that they can have with the health coaches. The mental health coaches we haven't specifically marketed, but we do have health coaches that someone sometimes recommend that someone speak to a mental health coach. Now, health is growing probably by 12 to 13% month over month, because I think, especially in the Hispanic community, is becoming destigmatized. And then the ongoing wellness programs. But we are working closely with our existing customers to create this workers' comp program to make sure that there's this triage model for people to be able to contact Misalud before there are any issues. And if there are these indicators that we feel that we should be putting them on other programs, then we have that. As I mentioned earlier, we are planning to add dermatology and dentistry as part of our virtual care.
Excellent. How do you do dentistry virtual? Walk me through
That was
that.
also my question. But if you think about physical care, about 80%, like the stats out there, about 80 to 85% of consults could be done virtually. And that's actually also true for dental. It's,
Yeah.
your gums are inflamed, take a picture, show it to me. How often are you flossing, brushing your teeth? And so it's just an extension, but I think because people are I think stigmatized by this idea that you always have to go into a dentist chair and that's the only time you ever speak to a dentist. No, you could actually take a lot of the benefits that physical health has taken from telemedicine and apply it to dentistry. At some point, if you need a crown replaced, you can't do that virtually, at least not yet. But who knows? Maybe sometime in the future.
Yeah, love that. Walk us through clinical outcomes or a case study if you can.
So clinical outcomes for us have been really based around lowering people's um, H1C, lowering people's weight, and I mean, we have success stories where people have lost 20, 25 pounds, 15% of their overall body weight. They were pre-diabetic to being completely in the clear. And so it is all over the board, but it is exciting that we do have clinical outcomes that we are able to report um, back, especially as we're getting into payers.
Yeah, it's fantastic. Is there a particular story about a member using Misalud that touched you that you could share with our audience?
So there was someone that was receiving end of life mental health coaching,
Okay.
and this person had pretty resigned herself to not receive care, not receive palliative care. And after about 18 sessions, which is significantly higher than our average socio during a period of about 6 months, they actually decided to receive care.
Hmm.
And at this point, we've already exceeded her expiration date. And she's living healthy and happy, and she believes that it's one of the best decisions that she ever made in her life. And so, obviously, from an employer standpoint, it's great. I think from her family standpoint, it's fantastic. And I think she just realized that because of Misalud, she knew that she didn't have to give up.
Yeah, it's fantastic. Misalud has quarterly reporting and analytics on outcomes and utilization. That's more than other vendors do more often. So why do you think that's important?
At least from what I can tell, just based on being in the industry, this entire industry is built around hoping that people don't use the platform that you've built, right? Like all of the pricing, it's like, well, it's going to be 1 to 2% utilization, so we can offer lower prices, and then let's hope that people don't use it. Same thing with insurance, right? Like let's give everyone insurance, but let's really hope that no one really files claims, or when they do, let's come up with reasons not to not to honor those claims. We're on the other end of that, and I think partly because of our business model, because we have a lower cost basis to be able to offer our services, we actually are very focused on people using our platform. And if the employers and eventually the payers see the positive outcomes, then they're going to want to use our model because we can offer our model at a significantly lower price point with
Mhm.
better margins for our business than others. And so we're very focused on building a product that people are going to love. And it also comes from our experience. Like Wendy, my co-founder, we have almost 20 years working together building B2B to C applications. And if that B2C component isn't working, then our customers, that B isn't going to see the value.
Yeah, no, completely agree with everything you shared there. Can you walk us through an employer that you work with and got online, and how were you able to help their employee population?
So we have a very large farm agricultural company. They do a little bit of everything in the supply chain of agriculture, and so they have farms. They also have packing warehouses. They also sell finished goods like delis at some of the biggest coffee shops, salads at Costco.
Hmm.
Um, and for many years, they've had a commitment on making sure that their employees are healthy. And they know that this is an opportunity to do well and do good because it allows them in an industry where they have a very, very high churn rate. Uh, they have about 96% retention of employees. And they believe that the reason that they're able to maintain that high retention of employees is because they are providing these additional services and healthcare. And so we've worked closely on digitizing the entire experience before they would bring in partners. Every year would be slightly different. The outcomes would be slightly different. The overall enrollment rates would be very low. The overall engagement would be very low. And for us, they've been a fantastic partner because we've been able to experiment on ways to actually show the outcomes for the individuals and also for the enterprise. And this partner is one of the ones that we've been talking about, offering dentistry services. One of the other things that we've talked about working with them on is we have a very large pharmacy partner in Mexico, and potentially offering their employee base the ability to offer remittances, but to buy medicine from those pharmacies in Mexico. It's the largest pharmacy in Mexico, so it's very likely that anybody would be able to have access to it. And so we want to envelop and have that wraparound care for our customers' employees.
Yeah, it's great. You mentioned like the economics, like you're able to have lower costs, thus charge your customers a lot less. Who do you see as your competition, and who should be looking at alternatives?
Today, there are roughly about 3 million people that go to Mexico, maybe closer to 4 million people that go to Mexico for medical tourism. And obviously, everybody always assumes that it's cosmetic, but knee replacement in a very nice, almost five-star like luxury hospital in Guadalajara will be between $7,000 and $12,000. In the US, it's 35,000 to 50,000. And I think that in the same way that manufacturing has been able to integrate across North America, I think the healthcare system should integrate across North America. And we believe that this is inevitable. And so for us, it's how do we build a large enough platform, build the word of mouth, become the leader in this space. So as it starts to integrate, we've already been there for many years, built up the trust, built up the network.
Fantastic. Really, really awesome stuff. So you've built companies in multiple industries, all of them have been very successful. What would you say are your guiding principles around, hiring great talent and building a great culture?
I will stay in this whole entrepreneurial journey as long as the industry will have me. I think a lot of people feel like there's a certain amount of ageism in technology, and I won't deny it. I mean, I see it and it scares me. It scares me personally if I become irrelevant. And so as long as the industry will have me, I will try to take my network, my understanding of building companies, my understanding of technology to try and go and solve big problems. The way that I do it, it kind of goes back to my early days at Google. And one is a product of their experience. And I learned how to treat people well, how to compensate them well, how to look for people who are incredibly smart, but also very driven. And try to have, I like to say that ignorance, arrogance, and confidence kind of go hand in hand. I think you do want a certain level of confidence of people that can feel they can go and change the world. And you want to avoid the arrogance because everybody needs to work
confident but
together.
humble, that's your ideal
Yeah,
balance.
and hardworking. And if you do that and it's the right market, then magic happens. And I'm excited to do this. And now with agentic AI, it's going to get really interesting because this also changes the way that we build out the company. Because you are going to be able to get some kind of multiple on impact for every individual. For us, we've already started to apply it on the healthcare side. So our health coaches and physicians, as they're doing a consult with one of our members, we are automatically transcribing the entire conversation and giving suggestions to our health coaches. And it's very easy for them to just see the overall recap. And if they need to hand over to a US licensed physician, all the notes are right there They're automatic. We've extracted the important insights and the recommendations. So when the handover happens real time, the physician in the US has everything they need to more quickly make a decision on what needs to be done with the member. And so it's exciting.
Very, very cool. What traits do you think a CEO needs to have, to be able to build a successful growth stage tech company?
So I would say that we're not quite at the growth stage. We're growing very fast, but also because we're fairly new and we're fairly small. And so going from small numbers to
But you've
medium-sized
done it
numbers is
before,
easier.
so
Yeah.
even though this one's in the early innings, like you've taken things all the way to the finish line before.
I think what matters most is having the right team around you. And it's people that not only have experience, but also want to build. Because taking a company from 0 to 50 million is very different from going from 50 to 150. Because when you're going from 50 to 150, you need to be putting the scaffolding together to get to $500 million in revenue. And the type of experience, more operational, the ability to hire people that are going to be looking at processes, that's very different from just being in the trenches, blocking and tackling, and hoping to get a little bit lucky.
hmm Yeah, totally makes sense. How do you lead from the front? I think it sounds like you've had a bunch of people who've worked with you at multiple companies. You mentioned like getting the right team in place. Like, how do you, what are your philosophies as a leader to attract great people and more importantly, keep them once, they come in the door?
So I think starting on the right foot matters. And I place a lot of importance on excellence. So I want to keep the talent bar incredibly high. And talent doesn't mean that this person's been doing something for 10 years. I also look for potential, and I want to make sure that I invest in that potential. Uh, so if you hire well, then everything is much easier. Once you're in, I'm in the trenches. Little things, and my co-founder Wendy says, she's like, it's the little things that you do, Bismarck. Like you always hold the door open for anybody and everybody. Everybody knows that they can Slack me at any time, email me, call me, and I think if you remove that barrier between management, leadership, founders, and the rest of the team, everybody feels like they're rowing in the same direction. And back to my point around one being a product of their experience, uh, this was after I had been at Google for about 3 years. It was like 2005. And I was
hmm
speaking with this woman, and she asked me, "Where do you work?" And I'm like, "Oh, a small startup in the Silicon Valley." And I caught myself, I'm like, wow, Google's already 4,000 people, but it
Yeah.
still felt small.
Huh.
And I think that that's the key in growing,
hmm
having that sense of smallness.
All right. What does everyone in the healthcare industry have to look forward to from Me Salute? Like, what are the next 5 years going to look like?
I believe that we are at a point with technology and by embracing health coaching to bring better care and better outcomes uh,
hmm
to people. And I think outcome-based care is moving in the right direction. And so where maybe the healthcare industry hasn't had the best reputation over the last couple of years, I do feel that there is a sea change in wanting to change. I
hmm
do believe that there's a sea change in preemptive and preventative care,
hmm
right? To make sure that people are living healthier, which will allow them to live longer and which should remove a pretty significant health burden from a cost perspective. And we'd like to be an example of that.
hmm Well, I ask everyone who comes on this podcast, how do you practice what you preach? You're in healthcare, you're living it, you're breathing it, but at the same time, you're in a stressful job, and I'm sure there's a lot of responsibility on your shoulders, and probably more work that needs to get done than you have hours in the day. So, how do you prioritize your own health? What do you do to stay mentally sharp, reduce stress? What do you do to exercise?
So starting companies is hard, and I usually tell people that if they're not willing to have their family, health, and friendships suffer, then they're probably not ready for this. I don't have much of a social life, and so other than work, I have 3 kids and a wife, and I try to spend as much time as possible with them. I get up at 4 o'clock in the morning and go for a run, which is the time when I'm able to do it. And
You ever see anyone else out, or are you one of the lone people out there that early?
I rarely see people. I do see a lot of coyotes, which is sometimes scary, or a deer will pop out of nowhere.
Makes you run
No, I
faster. It's
rarely see.
motivation.
Yeah, yeah. No, it is a little scary though when you see 3 or 4 that are just kind of around you, 3 or 4 coyotes.
Yeah.
Um, and I don't need to sleep a lot, which I think has always helped. But when my head hits the pillow, I sleep well. So I sleep about 6 hours, 6.5 hours a night. But that allows me to get a lot done. But back to my earlier point around the right team, my co-founder, Wendy, we've been working together since 2007. She was an early employee at Uyala.
Hmm.
And so it's phenomenal when, people already know what you want to do, where you want to head. And now, especially as I've moved into the CEO role of Misalud, like Wendy's just fantastic.
So curious, what makes her so fantastic? Like, why have you chosen to work with her multiple times? Like, what are the things she's done that ultimately make you want to, work with her as long as, she'll have you, is putting it in your own words.
So Wendy is one of the best product design people I've ever met. She majored in symbolic systems out of UCSD. And so symbolic systems is that perfect intersection of like AI, computer science, systems.
Hmm.
Uh, but she's a phenomenal designer. And so typically when you have creative types, they're not that great at operations.
Hmm.
She's also incredibly diligent.
Hmm.
And so things never slip through the cracks with Wendy. And she's our co-founder and COO, and I couldn't have asked for a better partner.
I love it. Well, when I asked how you guys get 40% enrollment, which is unheard of, you should have just said Wendy. If the product design is a big piece of it.
Yeah, Wendy is phenomenal, and again, she's built along with my other co-founder Cindy a phenomenal team, and I'm stepping into kind of this growth stage in the business.
It's incredible. I do think like a very large factor into people's health is what they're putting into their bodies. So, walk us through any healthy recipes that you make at home or your family makes at home that allows you to, be nourished and, get the right type of fuel in your body to allow you to operate on 6 or 6.5 hours of sleep.
My wife says healthy body, healthy mind, and I absolutely love Diet Coke, but I'm not allowed to have Diet Coke at our home unless it's my birthday. And so, we eat a lot of fruits, vegetables, a lot of protein, non-GMO, and so zero packaged food at our house. And all of our friends know that if we go over to their home and they have packaged food, that they're going to hear about it from my wife on Instagram. So
Okay, they get
uh,
publicly shamed.
they will be publicly shamed. That's right. So healthy body, healthy
But
mind.
any specific recipes that like the family loves when they're made, like everyone's very excited and they're like home favorites. The reason I ask is we have a Healthy Headhunters video series that's
Yeah.
just kicking off, and we want to use some of the recipes shared and actually cook them in our kitchen in our office, and we see how my team likes it.
So my wife makes a lot of scallops, and we always have broccoli and vegetables that are steamed, and then slightly grilled. And so no real recipes, just like I said, just focusing on the ingredients.
Awesome. I love it. Well, again, thank you so much, Bismarck, for joining us on the Digital Health Heavyweights podcast. Really amazing, growth and trajectory you're on at Misalud and incredible mission. So we're big fans of it. We're going to continue to monitor and root you guys on from afar. And thank you so much for not only joining us, but everything you're doing for, workers that, can use your services. So thank you so much.
No, thank you for having me, Norm.
Thank you for joining. Please like, comment, and subscribe below if you enjoyed it.